Hi guys, my name is John McCormick, better known as Jay Brady. It's nice to meet you all. I am sitting here in my bed at Duke University receiving treatment for acute myeloid leukemia. My senior year actually, I was diagnosed with leukemia after a couple months of thinking that I had mono. Last year when I got diagnosed, I had treatment for about 6 months till about July and August when I was put in remission. Went back to school and February 14th found out that it had relapsed. It was tough because, you know, you have to leave everything behind. You have to leave your friends behind. You just drop everything and go. I instantly got hooked up to an IV and started the chemotherapy treatment, and that's where I am now. It's been pretty life-changing to say the least. Chemotherapy, I guess I'll start out with, it's just a drug to basically slow down replication or growth of cells that have gone awry. So you start to feel nauseous and you start to feel weird when you eat food. And then of course the chemotherapy makes you start to feel tired and your blood count levels go down. The important counts are your red blood cells, which carry oxygen to your body. So that means if you have low red blood cells, you have low oxygen and you're tired. The white blood cells fight infection, so you become immunocompromised and you don't have an immune system. And the third one is platelets, which are the clotting factor in blood. And those are the ones that make it so that you form scabs and stop bleeding. So with low platelet counts, you know, you have to worry about brushing your teeth and getting cuts because otherwise you'll just bleed out. Every now and then my counts are low enough that I have to get transfused. So I get hooked up to this baby a lot to get blood and platelets. Thankfully yesterday, March 8th, I found out that I was in remission this second time. So we can proceed with transplant procedures. But before we get the transplant, I have to do another round of chemotherapy and radiation to completely wipe out all the stem cells in my bone marrow, so that I'm at a zero level, basically, of life. You know, I'm starting off anew, and once I receive the transplant of donor stem cells, they will bind or graft to my bone marrow and hopefully create and differentiate into red blood cells, white blood cells, and workable blood. And so one of the cool things is I'll have different DNA in my blood than from the rest of my body. Excuse me, I get hiccups a lot, as well as many other symptoms. So if I throw up on you, pardon me.